is Irvin Eisenberg. I'm the show host and owner of Resilience Occupational Therapy. The opinions on this show are not necessarily shared by me. As you know, I like to feature a variety of different perspectives, and not every healthcare perspective resonates with everyone. Additionally, none of this is meant to be medically diagnostic or prescriptive in any way. I'm really excited for today's guest, Melanie Meyer. She's a naturopathic doctor. She started Well Natured, which is a Montpelier-based naturopathic clinic. In addition to her practice, she also teaches pre-nursing and allied health students at CCV and is soon to complete her master's degree in public health. It's great to have you on today, Melanie.
Thank you for having me.
So I was wondering if you could start off a little bit explaining what naturopathic medicine is. I know a lot of people, ND sounds very close to MD, and then there's doctors of osteopathy and that spectrum. But where does naturopathic medicine fit in that broader doctor profile?
Naturopathic medicine has actually evolved a great deal in the past decade, actually. But it is a very, very old tradition of medicine. And the core of naturopathic medicine is we attempt to get to the root cause of someone's disease. So we sort of view the symptoms that somebody manifests when they are ill or struggling with something as an opportunity to address the cause of that dysfunction or disharmony in the body. So that's the core principle that guides us forward, is we try to get to the root cause. That is similar in many cases to the other styles of medicine, including medical doctors and osteopathy. But when we think about the modalities that we use, our key focus is generally utilizing the simplest and least potentially toxic medication or strategy possible. So a lot of our focus comes in using nutrition. Nutrition is always sort of a baseline modality for any naturopathic protocol. We do a lot of work around stress reduction. We make sure people are moving, and we try to remove any barriers to maintaining good health. So it's a little bit different in that in order to get to sort of that nitty-gritty piece about what may be imbalanced in someone's life, often we have to spend quite a bit of time in our visits, and really there's a lot of relationship cultivation between the naturopath and the patient. So because we sort of see ourselves as partners in crime, we're sort of making sure that we are the support people on the team, and we help identify things that aren't working in somebody's life. And again, a lot of times that takes quite a bit of time. So we're kind of known for having long visits. And when possible, we try to avoid using pharmaceuticals. We have different licensing in all 50, like in the 50 states. We are licensed in about half of the states in the US. So what that means is, in an unlicensed state, a naturopath can't necessarily can't prescribe any medications or practice medicine in the classic sense. In states like Vermont, where we are licensed and we have a very healthy licensure, we are able to utilize pharmaceuticals, and we're trained in them. But oftentimes people come to us because they're seeking something alternative to that pharmaceutical. So we utilize them when that's the best strategy. Otherwise, we use botanical medicine, we use, like I said, nutrition, and we use other strategies that are considered a little bit more natural to treat somebody. Okay, that was really long-winded. Sorry.
That's fine. It's a complex subject. I know that some people know what a doctor of osteopathy is, and I think they tend to think of them as a little bit more alternative than an MD. How could you sort of compare and contrast the ND versus MD versus the DO versus MD?
Certainly. Actually, DOs and NDs at their core have a lot of similarities. The ND, for example, we are trained in manipulative therapies, and that sounds like a terrible word, but like spinal manipulation. So similar to chiropractic, we cannot use the term chiropractic, but we are trained in physical medicine. And then DOs have a history of using similarly using physical medicine as well. And I know that in many cases, DOs are very much parallel in their practice, in that they are working in large medical centers and adopted into more conventional medical practices. So whereas NDs have sort of taken, we're still a little bit more peripheral in that sense. We are integrating a lot more so. And that was what I was referencing when I had said in the past decade, there have been a lot of changes, because we are integrating a lot more so than what we were even when I started my training years ago. But DOs, for the most part, are adopted into the broader medical system. And so many of them still will practice some of that physical medicine where they do spinal manipulation. But I know that many of them no longer do that and go with a little bit more conventional MD style practice.
And how does the actual training differ between a naturopath and the other medical and osteopathic doctors?
We receive the same basic core science training, and at the midpoint of our training, we end up doing a board exam. So we're thinking anatomy and physiology, immunology, microbiology. We do the same basic science training. We also study pharmacology, but we have pretty weighty training in terms of on a semester to semester basis. They're really stacked every semester in that 4 years of training that we get after you have your undergrad, and then you continue on with the ND program. And then the ND program has many hours of nutrition. We learn a little bit of massage therapy. We learn spinal manipulation, and there's a lot more refined training in those what are considered either alternative, integrative, or complementary. There's a lot of terminology that defines some of those things, but we spend a lot more time with those non-pharmaceutical treatment modalities in terms of our training hours.
Mm-hmm. And I just thinking about how much nutrition training is included, and I don't know if this is still the case, but I remember hearing some study looking at that the average med school does a total of 4 hours, not credit hours, 4 hours of nutritional education. So
yes.
Thinking about if you're even taking a 4-credit course in it, which it sounds like you have way more than that as part of your naturopathic training, that's just blows way out of the water the amount of nutritional knowledge that the average doctor has.
It really is. We were always taught that if someone's not eating well, if you're not feeding the cells in a nourishing way, it's very hard to maintain health. So that's definitely a large focus of our training. And I do think, if we're being fair, I think that the MD programs are starting to pull in some of these other modalities, including nutrition, a little bit more so. But a lot of times you find that in a more conventional medical practice, the MD will do the basic care with the person, but then often refer off to a registered dietitian or another nutritional therapist that may go a little bit deeper, take a deeper dive into that with them. Whereas in naturopathic training, because we consider that our wheelhouse, that gets integrated into our treatment plans more directly, usually.
So I know that naturopathic practices can really vary quite a bit. What naturopaths focus on? What's your focus?
My focus, actually, what got me into naturopathic medicine was digestive health. And that's a huge focus of my current practice, especially helping folks with chronic digestive disorders, including inflammatory bowel disease, including functional digestive disorders, where there's not necessarily a disease state attached to it, but somebody struggles with feeling like their digestion is optimal. So I do a lot of work in the digestive realm. But in terms of the practice, really, I see a wide variety of people. As our practice at Well Natured, we don't practice primary care. And we've very intentionally chosen not to practice primary care because we really wanted to feel empowered to have a little bit more time to spend with that relationship building piece. And a lot of times in the primary care model, you're addressing very acute complaints, whereas our practice does a lot less of acute work, and we do more of that long-term relationship-based, how do we optimize somebody's health? And so in doing so, we do see folks with a lot of chronic disease, like autoimmune disease. We see people with a lot of musculoskeletal pain. We see folks with fatigue. We see folks with anxiety and depression and stress-related disorders. So there are a lot of those spots where, because we spend so much time getting to know somebody, and because those circumstances are often a bit more complicated, that's where we really shine, because we have a little bit longer visit structure, and we are often seeing people a little bit more frequently, because we're making sure that what we're doing is really supportive of this long-term vision of health that the person might have.
So if someone has their primary care physician, and then they've got some sort of condition that comes up where they feel that you're a good specialist for that, then they refer them to you, and you can do a more in-depth dive. And as part of that, you're really developing relationship to sort of get to the bottom of what's going on for them.
Absolutely. Because we've committed to, doing those longer visits, and really working on some of the lifestyle pieces that may be impairing somebody's ability to heal. That's really where we shine. And we have great relationships as a practice. My colleague and I, was Dr. Lauren Mandich. We have really great relationships with a lot of the primary care offices in the area, and work really well together. And that's where I feel like our practice is actually very integrative, because we do try to combine the best of what conventional medicine has to offer with what naturopathic brings to the table, which is usually, again, that relationship piece, and a little bit more deep dive into the nuances of somebody's day-to-day living activities. And we try to optimize everything, including sleep, including how they move their bowels, including how they move their bodies, how they eat. Those are the pieces that we really dig into. What makes them most stressed? What keeps them from sleeping well? Those things we really get into the nitty-gritty together.
So you started off sort of nutrition and digestion were what led you to naturopathic medicine.
Yes.
And since graduation and starting your own clinic and everything, what interests do you have that you feel like you've been really refining over the years and want to continue to refine?
I'm extremely interested in infectious disease, especially chronic infectious disease, like things like the tick-borne diseases, and that gets very controversial at times, because in many cases in primary care, something like, for example, Lyme disease is treated as an acute problem. And it starts as an acute problem, but oftentimes we find that people have lingering symptomology after having had that acute illness. And so a lot of the folks that I work with here will be, there's this thing in homeopathic language, they never well since, like somebody was never well since this one incident. And so we do a lot of work with folks that didn't quite get their groove back, so to speak, after they had some acute illness. And so I'm really interested in looking at, like, what is the aftermath of like an infection, for example, and trying to help somebody to re-regulate their processes after their body has addressed that infection acutely. So I do a lot of work in that realm, and I find myself really interested in mind-body medicine. I'm a big practicing meditator, so I've been meditating since, for years. I can't even think back to when that would have been, but very actively since probably 2005. So that's part of my practice is employing, where I can, mindfulness, and really establishing a mind-body connection and helping folks to learn to read the signs of their body, because sometimes we're not taught to slow down and listen and be in our present moment. Like our society often doesn't really support that very well. So part of the work I do is try to help folks to restore their attention to their bodies, and learning to read their body's signals. And I think that's a big deal. I got off on a little tangent there, but the mind body medicine is a huge point of interest for me, and it applies in absolutely every single human being. We're not divorced from our emotional or psychological parts.
Yeah,
the body responds.
Yeah, I tend to think about in my work the pain management work that I do and helping people resolve what a lot of times might have started as an orthopedic injury, but I like to tell people, well, people may have told you your pain's all in your head, and that's only part of the story. All pain is all in your head.
Absolutely.
That's where we're experiencing the world from.
Phenomena.
So,
yeah.
So if we change our mind and our prioritization in our brain, that changes our relationship to the pain entirely, because that's where the pain exists.
Absolutely.
But I'm sure we could talk quite a bit about that. I did want to ask, so you've got this healthcare practice, and it sounds like you're offering some really great stuff. But at the same time, you're teaching courses at CCV, and you're working towards your public health masters.
I am, yes.
I'm
on the home stretch with that.
Yeah, and so do you feel like that's dividing you from your clinical practice, or what's inspired you to do these two other fairly large components of your work?
It's funny because there's the potential to be divided, but I actually am a person who tries to honor my varied interests. And so I feel like teaching and having the public health training that I'm doing actually enhances the practice quite a bit. For example, with teaching is a great love of mine. I love teaching. With teaching, over the years, I've become a lot more adept at explaining things. So part of our role as naturopaths is docere, which is doctor as teacher. That means doctor as teacher. And so part of the role that, people that are coming into my office aren't necessarily well trained in human medicine, right? Obviously, they're coming in. Some of them are, and we work collegially, but in the case that somebody, say, doesn't have a lot of science background or medical training, there's an art in being able to help them to understand the processes that are happening in their body when ill or when healthy. And so in teaching for so many years, I've become pretty adept at explaining things with people of all backgrounds. So I feel like that enhances my role, that docere role, the doctor as teacher role within the practice. And also, frankly, keeps my brain really fresh when I think about I'm constantly trying to keep my classes interesting in terms of my anatomy and physiology and my microbiology classes that I teach, constantly trying to keep those very interesting and current. So in doing so, I'm constantly studying and learning and building upon what I can do and offer clinically, because that it really goes hand in hand. So in that sense, that's actually, I feel like enhanced my practice. And then when it comes to being a student, public health and naturopathic medicine are actually really well aligned. And one of the things that I, over the years, have begun to notice is that it's very, very, when we think of like the myth of Sisyphus, where Sisyphus had to keep pushing the rock up the boulder up the hill or up the mountain, and it keeps constantly falling down. I always think of that a little bit in our medical system, because our society doesn't necessarily support radiant and abundant health. So when we think about when you're trying to address helping an individual to heal, it's always going to be a bit of that, like pushing the rock up the boulder, if you're not actually addressing those aspects of society and of our communities that are not supporting this person's effort at being healthy. So that was actually at the core of it, one of the things that really inspired me to study public health, because I do think that the work that we do with individuals in clinical practice is really important. But I also think that we have to think in terms of policy, we have to think in terms of systems. And solve problems at the broader level so that we can support those individuals in their quest for health, because it's very, very difficult when everything is working against an individual who is earnestly trying to keep themselves healthy or make themselves healthy. And so that sort of inspired me to like broaden the lens, so to speak. And so the public health program was something that, and like I really felt compelled to feed my brain a little bit more and look at health from a different angle. And so it's actually kind of inspired my practice. And in the long run, I'm hoping to apply some of what I've learned, or much of what I've learned in the public health program, to be a little bit more of an active participant in community-based health, both as a practitioner and honestly as an individual. So I'm hoping I can marry all of these in the long run. But I'm not walking out the door of practice. I'm really sort of in the mingling of these three different roles that I have professionally.
Mm-hmm. It sounds like they really feed on each other and support you as a more whole practitioner. I could see a parallel to that in what you're hoping for with your patients.
And I consider myself a lifetime learner. I like to keep it fresh. So,
well, thank you so much for coming on the show today, Melanie. It's been a pleasure talking with you.
It's been my pleasure to be here. Thank you, Irvin.
So that was Melanie Meyer talking about naturopathic medicine, public health, and teaching. You've been listening to Resilience Radio. I hope you enjoyed. If you did, a 5-star review on the podcatcher of your choice really does help out. Thank you to Aaron Marcus for providing us with the music for this show from their tune Some Biological Process. For full credits on that track, check the show notes. Again, you've been listening to Resilience Radio. Take care.